the volume change over time, I think is really worth delving into. As I alluded to earlier, we have had repeated headwinds from many different directions, but specifically, there are quite a few factors. First, the gastroenterologists initially put up a bit of a fight, and I would say that continues to some degree to this day, although mainly just from more of the private sector, because national societies like the AGA nominally endorse CTC as at least as a secondary option. And even though gastroenterologists don't directly control patient choice of screening, that their blessing, I think, is important to primary care providers. Now, speaking of primary care providers, those are the folks in the trenches that are largely responsible for colorectal cancer screening. And unfortunately, despite our efforts, they remain largely unaware of the benefits of CTC. And this lack of Medicare coverage also gave it perhaps an investigational feel, even though it clearly was beyond that. We also have a lot of PCP turnover, so it's a constant struggle locally to educate our new providers that are coming from places where CTC is generally not offered as a screening test.